Hey guys, and welcome back to this channel. Today I want to talk about an important topic that I see a lot of patients are doing wrong, and it has to do with shoulder height and resting position of the shoulder blades. If you've been following my channel and my work, you know that I'm a huge proponent of keeping your shoulders up. Keeping your shoulders up, guys, not down, up. You have huge, well, potentially very strong, potentially big muscles attaching to the scapula called the trapezius muscles, whose role is, one, to pivot and move the scapula into upwards rotation when you elevate your arms and load your arms, and that prevents shoulder impingement. Now, another very important task that this muscle has is to keep that scapula up and prevent the collarbone from slamming down into the brachial plexus, the nerve bundle here, and its accompanying subclavian artery and subclavian veins. If you leave your shoulders slouching, there will be a mild degree of compression continuously. Now, if you do something even worse, if you do this travesty of pulling your shoulders back and down to maintain good posture, you're doing yourself a really bad favor, guys, because it crushes the brachial plexus, crushes the subclavian vasculature, causes thoracic outlet syndrome, causes all kinds of chest, neck, arm symptoms, all right? Can also cause strange symptoms like difficulty breathing. It can affect the phrenic nerves. I've seen this several times where the patient develops like pseudo-asthmatic attacks after loading their arms. And then we get your shoulders up and the symptoms go away, guys. This is not the everyday thing, of course, but just be aware of that. Chest, neck, shoulder blade, arm, neck, back of the head symptoms after arm loading. Can also be strange chest symptoms as well. Like I've seen tachycardia. I've seen various dysautonomic effects come from this. You can read more about that in my work. Irregular heartbeat. I don't remember everything off the bat because I didn't prepare for that, so just go to read on my website. Either way, guys, I wanted to talk today about how to do this right because I get so many messages. I'm keeping my shoulders up and I'm still in pain. All right, well, you might think you are, and I see patients almost every day. Well, I do see patients every time my clinic is open, I see patients who claim they're keeping their shoulders up, and when I test them, the shoulders are in rock bottom, guys. So how do we test for that? Well, let's start with the basics. Number one, I recommend that your shoulders stay elevated by at least 1 centimeter during non-strenuous activities. That gives you a margin of error. That makes a small space between the nerves and the first rib and the collarbone, giving you a margin of error. Now, if you're partaking in some kind of strenuous activity, especially strenuous for your arms, I recommend anything between 2 to 4 centimeters, so between 1 inch to 1.5 inches, guys. All right? Now, how do you know? Well, first of all, how do you do that? This is a very common mistake that a lot of people do. They just pull back. And look, if I try to pull down after pulling back, nothing happens. Why? Because pulling back does not cause that vertical margin. If you just pull back, guys, you see I'm still on the nerves. Do you see that? You have to pull up. There has to be a vertical. There has to be a vertical space for the nerves. So you pull your shoulder blades up by about 1/2 inch, 1 centimeter during non-strenuous activities, and you keep them there. You keep them there. And 1 inch to 1.5 inches if you're doing some kind of aggressive activity. And the more aggressive, the higher in that spectrum you should be. So for example, if you're bench pressing, shoulder should be way up there. You can see if I drop my shoulder now, you see that? Lots of space for those nerves. Now, if I'm just sitting at my computer, I might just have a little bit of space to go on. That's enough. Does that make sense, guys? So how do you confirm that you're doing this right? Well, what I like to use the drop test. I was having a seminar, it's probably 4 years ago, guys, maybe more, maybe 5. And one of the participants, I remember this was the first time I hosted my scapular mechanics seminar. And one of the participants asked me, well, how do we know if the shoulders stay in the proper position after we set them in the proper position? And at that time, I was actually doing a measurement process for the scapular height, where I measured the superior angle of the scapula and align it with the T2 vertebra. The problem with that is that a lot of these patients have elevated first ribs. So if you align such a patient perfectly and you have them drop their shoulders, they will still be in depression. And I told, when this participant asked me this, I said, well, that's a really good question. I had to think about it for a second, and I told, well, I guess we have to test. And I invented this fairly simple, but very useful test that I call the drop test, where certainly if the patient has elevated their shoulders by ½ an inch, it should be able to drop ½ an inch. Does that make sense, guys? It is a really important principle, because this is a way that you yourself can assess and confirm or reject that what you're doing is correct. So I recommend that every 30 minutes or so, you just kind of freeze up and then you do a gentle drop test. And there should be at least a centimeter, ½ an inch of space available when you drop your shoulders. A very common mistake here, guys, I'm asking my patient, well, are you holding your shoulders up? They say yes. And I ask them, and I give them the benefit of that. I say, okay, well, do you think that you're in good posture right now? They say, and they kind of set themselves up. Yeah, I'm ready. Okay. And I say, freeze up, and they freeze. And I say, drop your shoulders. And they drop their shoulders, and nothing happens. What does that mean, guys? It means the shoulders were not elevated. Certainly, if the shoulders are elevated, it should be able to drop. Does that make sense? A very common mistake is either doing a crap job, obviously. That's the obvious one. But a lot of patients, what they do is that they pull back instead of pulling up. So you really want to get that vertical margin. That's very, very important. So do the drop test to assess and confirm if what you're doing is correct. I recommend completely freezing up. Like, don't fix it before you assess. And just, if you get the thought that, where are my shoulders right now? Just freeze up and then drop your shoulders, preferably with a selfie cam or a mirror, because normally what you feel in the beginning, it's not going to be what's actually happening. Most people, when they just lift their shoulders a little bit, it feels like there's a lot, but then when you do a drop test, to them it feels like it's a lot, but when I look at it, I can see that that shoulder blade is barely moving. So just be aware of that. So for the first, until you can do the drop test and what you see in the camera or in the mirror actually reflects what you feel, then don't trust what you feel. Does that make sense, guys? Okay. Now, there's a couple of things you need to be aware of here. Number one, you never push the shoulder blades down. The ribs are flexible. So if you push them down when you do the test, you will get a false impression of how much space you have. That's very important. So you just let gravity gently pull your shoulder down. You don't add any force to it. The other thing that you want to be aware of, although I kind of already insinuated it, is that you want to just gently let it fall down. You don't want to slap your shoulders down, because you will slap down on the nerves and the blood vessels. And that is not desirable, guys. And it will also not give you a reliable impression of that space that you're trying to assess. Hope that makes sense. If you want to test your shoulder blades when you're seated, one thing is if you're just walking around or doing something simple, but what if your arms are in a different position, or what if you're restricted? If you're in the gym, let's say you're doing a bench press, or maybe not the bench press. It's possible, but it's a little bit difficult. But you could technically just freeze, pull your shoulder a little bit down, and at least see if there's space. It's not possible to really assess it 100% reliably, but it's possible to do it. You can also, if you're doing a cable pull, for example, you can easily pull the shoulder down. Remember though, guys, you don't want to pull past the resistance, just come to the mild resistance. That's your stopping point, right? See how much space you have. If you have at least a couple of centimeters, you're probably within acceptable ranges of elevation. Now, what if you're sitting down, guys? This is really important, because a lot of patients develop upper back pain, chest pain, neck pain, etc. when they sit. And I obviously recommend sitting with tall arm leans. And look here, let me show you something. If I really slouch into this chair and I put my elbows here, you can see that they will support my scapula as a pillar. Do you see that? However, if I sit really tall in this chair and I lean my shoulder blades more, and I put my elbow more forward, obviously, if I want that arm, that humerus to act as a pillar for my scapula, it needs to be close to my body. Do you see that? If I rest my elbow here or far out to the side at a great angle in either direction, it's not going to act as a pillar, and that's what I want. Does that make sense, guys? So either way, if I sit like this, and you know, I can easily think that, well, I have elbow supports, I should be good. My shoulders should be supported. But it's not that simple, guys, because we need to confirm that we have the appropriate space for the nerves. So what I could do here, I cannot just drop my shoulders because I have the support here, right? So I could just freeze up, move a little bit forward, away from the, I'm just showing you, right? I will do it again. Move away from the path of obstruction, from the obstructing element. There, freeze up, and then drop my shoulders. And you can see nothing happens. My shoulders are in rock bottom. Does that make sense, guys? So you gotta make sure that the sitting position that you are in, support or not support, obviously, well, if it's supported, it needs to be tall enough and your elbow should be fairly close to your body. If it's non-supported, obviously you just need to use your muscles and keep your shoulders up. I'm going to add something to my document here. We have one more thing, worsening and trap pain, to my cheat sheet here. That's something important we need to talk about as well. Okay. Yeah, I guess we can talk about it right now because I think I'm done with my list. Yes. Okay, guys. So some patients, almost all patients will develop trap pain. That's normal. We'll talk about why. But some patients will also develop worsening of nerve pain when they do this. Interestingly, I have found that not just a lot of patients, when they keep their shoulders down all the time, it's like the nerves kind of go numb. And this is interesting because if you touch them at the nerves, they don't feel any pain. When these patients, they're like a little bit numb all the time. So when they keep their shoulders down, they never recover and they keep getting gradually worse. But then when they put their shoulders up, the nerve starts to work again and they feel temporarily worse. Just be aware of this, guys. If this happens to you, don't freak out. You need to trust the biomechanics here. How on earth could this be better for you than this? How could this be better for you? Of course it can't. So if that happens, just try to trust mechanical logic that you are certainly not making things worse by holding your shoulders up. The nerves are starting to work again, just like, did you ever fall asleep on the bus with your leg in an awkward position? You probably have. I have many times. And you wake up and you can feel that your leg is numb, right? It's numb, but it doesn't like ache. Now try standing on that leg, i.e. remove the nerve compression. It's a nerve compressed position, right? So you stand up on it. Now it's not compressed anymore. Now everything should be fine, right? But that leg will start to hurt fast and you can barely stand on the leg for a short period of time because the nerve is starting to work again, right? And then it returns to normal. So that's the same thing that's happening here, guys. You have the shoulders down, compressing the nerves all the time. You might feel horrible, of course, but you might also feel in that center zone where you're kind of accustomed to it. Putting your shoulders up might make you feel worse temporarily. So don't freak out if that happens. It's normal. Keep holding your shoulders up, for God's sake, all right? Another thing that's very important is trap fatigue. Trap fatigue, if you're used to keeping your shoulders down all the time and you start keeping your shoulders up all the time, needless to say, your traps are going to hurt, guys. That makes sense, right? Your traps will go from doing nothing to doing everything in a really short period of time. And obviously, you will develop severe fatigue and you might even get significant inflammation of the muscle. Now, how do we deal with this? Well, let's say you work as a painter. Yeah, you're going to have a rough time. This might take you 6 months or more to adapt to. No, you will adapt. It's just a matter of time. So you might have to start, with a couple of hours and go gradual from there. Now, for someone who has an office job, blessing and a curse because you can simply use elbow support, right? You can use elbow support to get your shoulders up, and that way you can maintain the position all day long, no problem, guys. You should not torture yourself, though. That means that if you keep your shoulders up and it's starting to burn, first and foremost, you don't need to be afraid. That's completely normal. But if that happens, or when it happens, just take a break. Go to lie down, use elbow support, whatever. Take a break, recover. So instead of pushing yourself to that brink where you become demotivated. Don't do that, or scared. Don't do that to yourself. Just take a break, for God's sake, guys. All right? So you might also not just get pain when you hold your shoulders up. The muscle might get inflamed. Why? Well, because it went from doing nothing to doing a lot, right? So just be aware of that. So if you start to have a lot of like headaches, pain in your neck and so on, that's different from what you had before. Number one, you're probably doing too much and not resting enough. But the other thing I want to tell you, this is not dangerous, guys. You know, just rest it off, and then when you recover, do less. It's not dangerous. So just calm down and do less. And in rehabilitation, less is more. And the more vulnerable the muscle is, the less we need to do and the more time it is to recover. I hope that makes sense. I have seen, though, that with the majority of patients, I would say that within a couple of months, the majority of patients are able to hold their shoulders up through the majority of the day, if they are motivated. And you know, I have some patients that say that they're able to do this within 2-3 weeks, super motivated and not so ill perhaps. And then I have other patients that, you know, after 6-9 months, they're still failing the drop tests. And you know, this is a motivation problem, guys. In almost all circumstances, unless you had some kind of very, very, very aggressive injury. And even then, honestly, in most circumstances, it's a motivation problem or poor understanding of the what's and the whys. Why are we doing this? And how do we do it, right? Okay, my friends, so we talked about how to do this wrong. Most people do it wrong by pulling back instead of up. You want to have that margin, that vertical margin. We talked about a drop test, very important. For example, you can put your shoulders up, you start going for a walk. After 30 minutes, you drop your shoulders, nothing happens. It means that they started creeping back down and you didn't notice it. That's normal, guys. That's the point of the drop test. You realize your mistake, you put your shoulders back up, you try again. And slowly but surely, you will become more proficient at this. I've been holding my shoulders up for many years now. For me, it's easy. It's like a second nature. But yeah, in the beginning, I got fatigued and it hurt. So you suck it up and you keep trying. We talked about testing when working out. I talked a little bit about that at least. We talked about testing when seated. I talked about not pushing that clavicle down or slapping it down. Just gently let it drop and let it stop naturally. That's the space you have. And we talked about the potential for worsening when you keep your shoulders up. And that's two things: either transient awakening of the nerves, which is completely benign and to ignore. Even if it really hurts, yes, completely benign. You need to trust those mechanics I showed you. Or if you're having just focal pain, muscle pain in the trap, that's probably not a nerve issue. You're most likely just overtraining it, going too hard, too fast. Start more gradual. Maybe an hour in the morning, hour in the evening, maybe more, maybe less. Depends on your exact situation, guys. So I hope that this will helpful for you. I know, in fact, that this will help a lot of people. I hope also that more patients will take this seriously, and I also hope that a lot of clinicians will take on to this, because it is really a very, very effective treatment strategy for chronic upper limb, chest, shoulder blade, neck pain. Very, very effective. Also very effective for scapular dyskinesia. Obviously, if you're never using your trap in posture, what is the likelihood of that trap performing perfect upward rotation when you're going underweight? Pretty slim, guys. I hope that makes sense. So we're already at 20 minutes. I think I will stop with this. I wish you all a great day, guys.